Hello, everyone. I'm Peter Mogayzel, the director of the Cystic Fibrosis Center at Johns Hopkins, and I wanted to welcome you to our Patient and Family Education Day. I'm going to give you a brief introduction and a review of what's been going on in the past year. And then we're delighted to have Chris McLeod and Dr. Jennifer Taylor-Kusar speak to us today. I'm just going to share a few slides with you. So just a brief introduction. Chris McLeod is going to speak to you about his experience with cystic fibrosis. We're going to take a brief break and then have a brief yoga flow that's been created by Myra and Abigail Jeffaloni. And then Jennifer Taylor-Kusar is going to speak to us about CF therapeutics and what's been happening up until now and really what the future holds for us. I encourage you to put questions in the question and answer box within the Zoom. You can also put comments in the chat as well. I want to thank our sponsors, the Behrman Foundation, the Cystic Fibrosis Foundation that is hosting the webinar today, and Casey Cares, a foundation in Maryland that is supporting families with chronic disease and is really reached out to us to help our families with needs beyond medical care. Those people that have registered for the webinar beforehand should have received a form for Casey's Cares to fill out in order to get connected with them. People that have registered more recently will be contacted by Emily, our social worker, to reach out to you. We have some corporate sponsors as well, and I appreciate the efforts that they have made to help us. There are some new faces in the adult clinic. Thomas Skeeter is a new mental health coordinator, Isabel Page is a new dietitian, and Sarah is an administrative coordinator. Pamela Jackson has also joined as an medical office coordinator. Nicole is our new respiratory therapist in the pediatric pulmonary function testing lab, and Emily, who many of you have met, is our social worker. Unfortunately, although Emily has been a wonderful help to us, she's going to be leaving us later in the year to move to the NICU, but she will be with us for the next few months as the transition takes place. But maybe the most important new face is Quest Jordan. This is Dominique Jordan's little boy who was born last month. Many of you know Dominique is our pediatric respiratory therapist in the pulmonary function testing lab. If you want to find out about all the staff, you can look at our website, hopkinscf.org, where there are bios on the staff and also the faculty and researchers as well. If you need to contact us, please feel free to use MyChart. If you've had a scheduled appointment with a provider, you can use MyChart to contact us, and we can pass along messages to any of the other staff that may not be on your MyChart. This should be used not for urgent needs, however. If you need to talk to us urgently about an illness or something else, you should give us a call. It's been a remarkable year. This is actually the exact same slide I showed last year, Trikafta, COVID, and revolution in care delivery. It has been a revolution, really. Kalydeco, the first highly effective modulator, was approved almost 10 years ago. It'll be 10 years in January. And last year, I talked about Trikafta being approved for up to 90% of people with cystic fibrosis. And this really did usher in a new approach, a new era of CFTR, of cystic fibrosis care. But I don't think it is until more recently we really understood what this meant. The excitement around it as Trikafta became available for younger children down to age 6. I just want to show you a little bit of data. This is the trajectory of lung function in people with cystic fibrosis at different ages. What you see here is different birth cohorts, people born in 1990, moving up to people born in 2010 and 2014. And in each age group, people are healthier. Their lung function is better in childhood. But as they get out to be adults, lung function declines, and it's been similar in different age cohorts, regardless of the year you were born in. However, over the past year, with the introduction of Trikafta, things have changed. These trajectories are now flattening out. The whole problem in cystic fibrosis is that lung function declines faster than the general population. So this is evidence that potentially we can slow that down or even stop that decline if we treat early enough in mild disease. This has led to an improvement in survival. Survival measured in 5-year increments. The median survival is now expected to be 50. But even more than that, there's year-to-year changes. This is the number of transplants performed every year in the cystic fibrosis population for lung transplant. Pediatric is in green, adults are in blue. There are about 250 transplants performed each year over the past few years. But last year there was a dramatic fall as people really did get healthier with the widespread use of an effective modulator. And maybe even more exciting is this slide. This is the number of women that gave birth with cystic fibrosis that gave birth last year. Typically, there are about 200 pregnancies a year. Last year, there were 619. Now, obviously, there are a number of people that aren't able to take advantage of modulators, and it's important for us to realize that there's a lot more work to be done. I'm sort of showing you last year and this year. This is the slide I showed last year of COVID in Maryland. We talked about maybe there would be some additional cases and problems moving forward in the coming year. I don't think any of us really expected what was coming. This is the surge that happened last winter, followed by some peaks and valleys in the number of cases. With COVID cases, there's an increase in hospitalizations that tracks with that, and an increase in deaths. As we've gotten better at treating patients with COVID, the mortality rate has declined, but people still are getting quite sick. The key to preventing this is vaccination. We know that COVID-19 is caused by a particular virus called SARS-CoV-2. Its infection can be spread by droplets or aerosols, which means there's airborne spread, which is why masks are important as protection. COVID's not just a pulmonary disease, it affects many organs. And vaccines are very effective at preventing severe disease, and in fact, at preventing all disease. So we really recommend that anyone over age 5 be vaccinated against COVID. And it's clear that booster shots are necessary. There is waning efficacy of the vaccines over time. Some therapies are available now that lessen disease severity for those people that are in the hospital or have comorbid conditions. And you may have heard that there are novel medicines that have been developed by Merck and Pfizer, similar to Tamiflu, that can really impact the disease early on. This is a distribution of people that are infected with COVID in the state of Maryland. The vast majority of infections are in people aged 20 to 40. However, the deaths are typically in people that are older. It's shown here in green. Vaccinations are key. We're moving into being able to vaccinate children that are 5 years and older. And we're moving towards getting a point where we can have enough people vaccinated to prevent widespread disease. But the vaccines do wear off. This is data showing COVID cases for people that are vaccinated, that are not fully vaccinated in blue, and starting in January, where you see the majority of people that are infected are unvaccinated, but there are a few people that are vaccinated that get infected. However, as the year has gone on, more vaccinated people have become infected with COVID, suggesting that the immunity does wear off, and that reinforces the need for boosters. In CF, we see a similar trend. This is the number of cases each week in adults in red, and in blue seeing children. So it follows the distribution that I just showed you, with more adults being infected early in the pandemic, and now almost an equal number of children and adults being infected and later in the pandemic. This relates to the novel Delta virus or Delta strain, which is more likely to infect children than the earlier strains. In pediatrics, there's been about 1,500 adult cases and 700 pediatric cases reported to the Cystic Fibrosis Registry, and about 311 hospitalizations. These numbers of cases are probably underreported since the most severe cases are likely reported to the registry. But it does show you a hospitalization rate of about 17% for adults and about 8.5% for children. And 17 people with cystic fibrosis have passed away due to COVID. Typically, those people that have more severe disease or have already had lung transplants. The other thing that happened during this transition, or during the pandemic, was a transition to virtual care. This is the slide I showed you last year with in-person visits to the pediatric clinic shown here in green, transitioning to virtual visits in gray, and then a mixture over the course of last year. The adult clinic had a similar transition and continued doing mainly virtual visits for the majority of last year. As we look forward into this year, the pediatric clinic has really moved to doing about 80% of its visits in person, with just a few virtual visits in selected cases. The adult clinic had a longer transition. This is January right here, with the majority being seen virtually until July, where they really switched over to almost entire in-person visits. I think moving forward, there'll be a need for virtual visits, but there's a clear benefit to coming in person, getting lung function testing, getting sputum samples. And we want to continue to have a mixed model where we can accommodate everyone's needs to get the best possible care. At this point, everyone age 6 and older should have a home spirometer. If you don't, please contact the pediatric or adult clinic and we can supply you with one. These were generously provided by the Cystic Fibrosis Foundation. So the future, COVID is going to be with us for the foreseeable future at potentially high levels. Vaccination is really key. The holidays are coming. Travel is certainly reasonable for people that are vaccinated and for others that can take precautions. But you do need to be aware that we need to think about how we're going to move forward and stay healthy. Finally, I want to remind you, we do have a number of social media platforms to try to keep people engaged with the CF Center. Our website has information about CF, clinical care, as well as our research programs. You can get information about our center, but also cystic fibrosis in general there.